I'm Dr. John Davis Akara, and my AOS number is A19733, ratified member. So, making regional language translator apps for eye care professionals. I have no financial interest. I have made these apps myself, and I have put them for free on the Play Store. You can download them for free on the Play Store. So I found that there was a need for this, that we talk about ophthalmology, but there is something which helps us in doing ophthalmology. So India is a very diverse multilingual country. There are 23 official languages and there are 122 major languages. So these are just the major languages. There are more. So you cannot expect an Indian to know all the languages. You cannot expect an Indian to stay in one place, in one region where he knows the language. Indians will travel all over India. Indians have to travel all over India. That is what we want to do. So doctors, we have to speak and interact with patients, not like engineers. We have to know the language. We have to speak the language. We often study and work in different parts of the country where the language is not our language. And many young doctors, they struggle with the language during their training. So because of the language struggle, you devote less time to the learning medicine, diagnosis and treatment. You are more worried about your language skills. So I am thinking of doing something to help students, doctors, students, help them with their language problem. So often they miss clues from diagnosis. Patients' diagnosis, their case history, everything is just yes, no. You don't ask proper questions, you don't get proper answers. Patients may tell you, but you won't understand what they are saying. There are often there are other resources available, dictionaries and books like this. So when I did my PG, when I did my UG in Pondicherry, Jipmer, I got a book like this. 30 days passed, 1 year passed, 5 years passed. I never completed that book. Then I did my PG there. I never completed this book. So most of what I learned was just by learning the others speak, my colleagues and the nurses in the hospital, all that. I never completed this book. That is the point. And there was a Tamil for Medicos book which was more useful. So in I think several years back, one of our professors released this book. They haven't modified that book and it was very useful. So that is most effective. If you have your own notes, that is most effective. You cannot use a standardized language learning book. You need a specific medical book. And I decided to make smartphone apps to help with history, examination and counseling. I translate into different regional languages. So I started with Tamil. So these are the things which subsections which I did: history taking, slit lamp examination, treatment counseling, during anesthetic block. Very important. During surgery, keep looking at the light and all that, don't move your head, what is happening, all those things. Post-op instructions. So these are things which we don't think about. We just think, okay, you just have to inject and patient will tell it is paining, patient will tell it is something else. We have to understand what they say. So I made this, started with Tamil, made Bangla also, working on Malayalam and Hindi, available on the Play Store. This is how I did the coding. So this is basic HTML and converted the HTML using something called PhoneGap into an app. And this is Adobe PhoneGap build. You can upload HTML files. If you know a little bit of web designing, you can do this. So I did that and made these apps. And I received feedback on corrections, changing the design, rearranging. So initially I thought you'll just have phrases. I thought I'll have searchable options, but I found that people do not want searchable options in all cases. They just want, okay, I am at the slit lamp. These are the things which I have to ask. Even if they have been told that previously, you will keep forgetting when you are a newcomer. So all those were grouped into pages. Answers. People will ask questions, patient will say something. So you have to understand what the patient is saying. So that was also incorporated. And it was updated like that. So there was general history. There was just ocular history taking. Then there was, in the OPD setting, you can ask more history. You can do slit lamp examination, look up, look right, look left. Simple things, but you need to know it at that point. Just 2 words, you can tell them and you can continue. Whatever language the patient knows. And then I had the greetings, the relationships, numbers. So all these are in separate pages. So you can ask like that. And these were the suggestions I got for giving anesthetic block. Was one big suggestion, because when newcomers come, they go to the block room. And then we found that it was useful for doctors new to the target language, but once they are settled in 1 year, they're fine. They don't need the app anymore. Pronunciation was little difficult, even with the transliterated ones, because when you write in English, it doesn't actually match the regional languages. Preferably, you have to be translated to some other regional language. And we found that it was more convenient to arrange into pages rather than a search box. Even though a search box was useful, translated pages were more useful. Then we found that it is not a problem which is just a simple problem. It makes diagnosis difficult, it makes treatment difficult, it makes adherence to therapy difficult. It makes the patient's trust in the doctor less. So this will help in all that. It's not like other professions where you can just do something and finish it off. You have to actually build a rapport with the patient. So that is the point of this. And this is, but to conclude, I tell that language difficulty is a major problem, even though we don't look at it that way. And this is to help you in doing ophthalmology without an extra headache of learning a language. Thank you. These are my references.